we'll talk about advances in knee surgeries, therapies, and rehab that allowed RG3 to make a seemingly rapid recovery. We'll be back.
Well, as sports fans stagger through the desert that is sports in the summertime, there is hope. Redskins training camp opens tomorrow in Richmond, and it'll be our first chance to hear from quarterback Robert Griffin III, since he tweeted yesterday that the doctors have cleared him to practice full speed with the team. Now, we all know by now that RG3 had that reconstructive surgery on his injured knee after last season's playoff loss to the Seattle Seahawks, and while he has been cleared to practice, there are some reports that it is unlikely that RG3 will play in any preseason games. So, whether he plays in the preseason or not, RG3's rehab after reconstructive surgery has been described by some as pretty amazing.
And the quarterback recently told USA Today Sports that his rehab has been both physically and mentally taxing, but all worth it. Anita Brickman joins us with this health alert to talk about what RG3 did and how. Anita?
Oh, guys, as you know, that ugly injury in the first round of the NFC playoffs last January tore both the ACL and LCL ligaments in his right knee, and Robert Griffin III has been describing as being on an accelerated rehab track. He has said it himself. To give us a better idea of what that really means, I'm joined by Dr. Jason DeLuigi, Director of Sports Medicine at MedStar National Rehabilitation Hospital. Doctor, thanks for being here.
Thank you very much.
So we're basically looking at 6 months from the time of this terrible injury and the surgery to now going into training camp. Is that fast?
Yes, it's quite a rapid and remarkable recovery so far by RG3.
Okay, so are we talking about these athletes who seem to be able to do this? Is it they have innate physical prowess and stamina built in? Do they follow a rehab program that's more rigorous than others? How do they do it?
Yeah, it's a combination of both of those attributes. So by being athletes, they work year-round to make sure that they're at the peak physical condition. And then we have advances in rehabilitation that when you have an injury, we get more specific with each of the different training opportunities to rehabilitation faster.
So let's talk about some of those advances. What can you give these guys to give them an extra push to get better faster?
So in addition to additional rehabilitation techniques and surgical techniques, there are opportunities such as treatments of PRP, which is platelet-rich plasma.
Okay, what do you do with that?
So it's taking your own blood, and then we would utilize that. We'll harvest out your platelets, red blood cells, white blood cells, get a concentration of your healing cells. And so we'll take a volume and decrease it down to the highest concentration of these cells, and it can be placed in that exact area. This is something that we have been utilized in many other athletes, and most recently Bryce Harper with his knee injury a few weeks ago.
Wow, and Adrian Peterson, did he have this too? It's
Adrian Peterson, Kobe Bryant, Tiger Woods have had these as well, and other treatment for different injuries.
Okay, but now RG3 has had 4 reconstructive knee surgeries in these past few years. Do the repeat fixes put him at greater risk of another injury?
Yes. Anytime you have an initial injury, the surgically repaired or injury can always have a chance to injure again. It's not quite as strong as your native or natural ACL, and so even though there's advances with rehab and surgical techniques, it could be at a further risk.
So does he need to change the way he plays? That's the big question.
Hopefully not. He's quite a dynamic quarterback, but I will be surprised if how many times he has him running the option this coming year.
Exactly. He is exciting to watch. Dr. Jason Luigi from MedStar NRH, thanks for giving us your insights.
Thank you very much.
Derek, I know you're excited.
I am very worked up. I'm just hoping he stays healthy, so I appreciate you too, Dr. Luigi.